and share my screen with you guys. So my purpose today really is just kind of to, introduce you to pharmacy, because I understand that most people at David Center Pre-Med and probably don't even know a whole lot about pharmacy. So we wanted to kind of get it in your head and just see if it's something you might be interested in. And I'm going to watch my time because this may run a little bit longer, so I may run through some slides pretty quick. All right, so let me introduce myself. Cathy Worrall. I'm the Associate Dean for Admissions and Student Affairs at the MUSC College of Pharmacy. So I'm going to be running through a few things with you. So, and again, please keep yourself unmuted so we can just kind of have a conversation too. I'm happy to do that. You will not bother me at all if you interrupt me or actually interact with me. That's great. So the first thing I like to just kind of get from folks that may or may not know so much about pharmacy is, what do you think of when you hear the word pharmacy? What comes to your mind?
CVS, Walgreens.
Yeah, I mean, for me, I just imagine a bunch of pills, and then I don't know what you guys call it, but having like a divider to quickly count all the pills and put them in place.
All right, so that's pretty typical. As most of the time when you ask somebody, well, what can you do with a pharmacy degree? Well, I can work at CVS or Walgreens or Walmart or a grocery store. And there's a lot more to it than just that. That's only one small aspect of it. So most people, when they think of pharmacy or even pharmacists, this is kind of the picture most people think of when they're thinking of what a pharmacist does, right? So what I'm hoping to do is to expand your horizons a little bit and talk more about what pharmacists are really, a lot of pharmacists are doing out in practice now. We've really gotten away from being so product centered and have transitioned into a much more patient centered care team member with the healthcare team. So these are just a few images of some of the contemporary images of what pharmacists are doing now. We do still have a lot of pharmacists that are working out in the community setting. Probably about 45% of our students will move on to work in a retail chain kind of environment, but that environment has changed significantly. And you probably know that from flu season. You see community pharmacies giving flu shots all over the place, and you're going to probably see them giving a lot of COVID vaccinations as soon as those vaccinations become available. So you're seeing pharmacists even out in the community chain setting doing a lot more patient-centered care. They're involved in a lot of chronic disease state management in conjunction with physician practices, monitoring blood pressures, anticoagulation, lots of different types of chronic disease states.
1 second. Can everybody see your screen? I am not able to see your screen.
Oh, can you guys see it?
No.
Oh my gosh. I wonder why in the world you can't see my screen. That is really strange. All right. Let's try screen sharing again. Maybe something weird is going on.
There we go. Yes.
Okay. Well, goodness gracious. Thank you for letting me know you couldn't see my screen.
No worries. I heard you clicking through. I'm like,
yeah. So you missed my fun images back here of there's Walgreens and CVS and what people normally think pharmacists are doing back there. And a lot of them are still involved in a lot of those sort of activities. But yeah, I'm glad you can check these pictures out. So talked about the top left one just a few minutes ago, as far as immunizations and different things that chain community pharmacies are involved in with chronic disease state management. The top right, or the top picture, shows a pharmacist working in the operating room, which probably a lot of people may not know that pharmacists are in the operating rooms. They're probably in just about every area of the hospital that you can think of, from operating rooms to emergency rooms and everywhere else. The picture on the top right shows a pharmacist involved in telemedicine. That has been really big, especially the last few months with COVID. We've been doing a lot of telecare, and pharmacists are right in there with everybody else, managing patients through that particular technology. If you move on to the bottom left-hand picture, this is a picture of one of our faculty members. She is a pediatric pharmacy specialist and works in the pediatric surgery area and general pediatrics. So again, just like you would probably think of with medical doctors, pharmacists specialize in all different sorts of areas of pharmacy. They do residencies and fellowships, very similar to what physicians do, just not quite as long in training. But so again, in the hospital, you'll see pharmacists in just about every patient care service you can think of. The middle one on the bottom is actually a nuclear pharmacist, which you may or may not have ever heard of. This is someone who actually works with radionuclides, putting those things together for patients who have to have procedures done that require nuclear medicines. So there's pharmacists that literally specialized in putting nuclear medicines together for those procedures. And then the last one on the bottom right is an actual, this is an independent pharmacist who owns a compounding business. And so he spends his entire day doing nothing but compounding prescriptions for various health professionals, whether it's dermatologists or veterinarians. A lot of different folks need dosage forms that aren't commercially available, and pharmacists can make those for them. So these are just a few of the different career paths or different areas of pharmacy that you can get involved in. So as far as thinking through whether pharmacy might be the right fit for you or not, just like to always make it clear to everyone that the pharmacy profession, or the degree that you come out with is a doctor of pharmacy degree, just like you come out with a doctor of medicine degree. Basically, it's the same thing. We're in graduate school for 4 years, the same way that people that are in medical school are. Our focus is just different in terms of focusing on drug therapy management and all the intricacies of that. So this next slide just talks a little bit about what pharmacists do and what they're involved in, and how we may be a little bit different than nursing or medicine or other health professions. So I think anybody who's interested in the health professions wants to help people get well. That's pretty standard across the board when you read personal statements from people applying to the health professions schools. The thing that makes pharmacy different, again, is that our focus is on medication therapy management. So if you come into pharmacy school, you will become the medication therapy experts. Our students are literally spending 4 years in graduate school doing nothing but learning how medications work, how to optimize medication use, and all the physiology, pathophysiology, and therapeutics that go along with all of that. So they're very much an integral member of the patient care team. I'd say especially on the inpatient services, the physicians rely very heavily on the pharmacist, especially at MUSC, for ensuring that patients are getting the right medications, that they're not having any adverse effects or any drug-drug interactions from the regimens they're on. And even like in the community sector, they're really important in determining why patients are non-compliant with medications, because that's a huge problem and leads to a lot of excess cost when patients aren't taking their medication the way they need to. So those are just some of the ways that pharmacists are part of the interprofessional team. There is a lot of direct patient care in pharmacy work. There's a lot of non-direct patient care as well. And I'll show you a big listing of different career paths depending on what your interests are. Lots of different ways that you can use the pharmacy degree. The profession itself is a very stable profession. I don't see the demand for pharmacists going away anytime soon for a couple of reasons. One is that there's new drugs coming out all the time and it just doesn't stop. And it's very difficult to stay on top of all the new therapeutics that go along with that. So that's one reason I think pharmacy is here to stay for a good long time. The second, in addition to more drugs coming out on the market, people are writing more prescriptions now than they ever have in the past. So just the prescription volume for patients is quite large. And then probably the biggest factor is the aging population. And as people age, they tend to have more and more chronic disease states that have to be managed, which puts them on more complex medication therapy regimens and can lead to a lot more issues as far as having adverse effects from those regimens. So again, pharmacists are a really important part of the team to help manage all of those sorts of issues. The job market for pharmacists is really good. It's got great mobility as far as jobs go. I think that's one of the reasons females have really become the majority of pharmacists now. There are options to work part-time if you choose to do that, but there's a lot of just mobility in terms of moving from place to place or different types of practices. The Salary for most of our starting new graduates is around $126,000 a year. So it's a pretty good investment for what you're putting into graduate school as far as coming out after 4 years and being able to make that salary. There's a lot of really cool things going on within pharmacy as far as innovations and technology are concerned. One example of innovations is just what's going on within pharmacogenomics, which is a practice where people are looking specifically at patients' DNA makeup and determining drug therapy management based on that person's specific DNA. So there's a lot of really interesting things going on with that, and a lot of really innovative technology, both in the research laboratories and just in the practice areas as well. The one listed about bioterrorism there, pharmacists are trained in bioterrorism, and again, because they're the most accessible healthcare professional, there's probably a CVS or Walgreens or some sort of pharmacy within 5 miles of your house is pretty typical. So any time that there's any sort of mass issue like with COVID right now, it's very easy for patients to get to a pharmacy to get vaccinated or get whatever medication they might need to combat that sort of issue. So again, I think pharmacists are going to be playing a really big role once the COVID vaccinations come out in helping to get the public vaccinated against that virus. And then finally, pharmacy has always been a very highly respected profession. So these next couple of slides just show you what some of our pharmacists, how they helped in COVID. The first one shows some of our compounding pharmacists at MUSC. You can notice in the background, they're working at a distillery to compound hand sanitizer when it was on shortage very early on. So they were very involved in that effort. And this is another picture of a couple of our ambulatory care pharmacists who literally brought the clinic out to the drive-through, if you want to say that. You can see there's some diabetes supplies, monitoring equipment, anti-coag, point of care testing, different things that they would use up in the clinic that they just brought right to the curbside and continued to manage their patients. And this is the slide I was referring to as far as career paths in pharmacy. So you can see there are many, many different things that you can get involved in. You can teach in several different areas, whether it's working as a clinician educator, so being a faculty practitioner educator or a research academia faculty member. We also have an area called ESAS, which is economic, basically it's economics research. So all of those things are available. In the hospital setting, there's a lot of different opportunities, both in the inpatient and outpatient setting. A lot of pharmacists working as clinical specialists, which I mentioned earlier, and all the different specialty areas you would think of, just like a physician would be involved in. On the ambulatory care side, again, those are pharmacists working in clinics managing patients with chronic disease states. As an example, my husband works at the Veterans Affairs Hospital here in Charleston, and he has a full clinic schedule every day where he just sees patients every 20 minutes, one right after the other, managing chronic disease states. And he just works with the physician team to manage those patients. So you can see a lot of other things here, lots of different opportunities within the federal government, like the NIH, the FDA, public health services. I mean, just lots of different opportunities there. What are some of the other things listed here? If you're not so patient care oriented and want to be involved in healthcare, but maybe not so much at the bedside, you can get into things like managed care or medical communications, that sort of thing. Lots of opportunities in the pharmaceutical industry if research is your thing, or you're more in the sales and marketing side and like the business kind of side of the practice. So again, just lots and lots of different career paths to explore depending on what your interests are. So I think just for the sake of time, I'm going to flip through the information about the MUSC, and I'll send you guys a PDF copy of the slides so you can look at that. But these are just some slides I have in the deck just about MUSC specifically in our university campus here. I'll mention a couple things specifically about our program. We have 3 dual degree programs or concurrent degree programs that we offer at MUSC. The baseline program is the Doctor of Pharmacy degree, so there's no bachelor's in pharmacy. Everybody has a doctoral level degree. It's been that way for probably 20, 25 years. You can do a PharmD PhD combined degree here, a PharmD MBA, which we do in conjunction with the Citadel School of Business. And our newest concurrent degree is the PharmD MSHI, which is in conjunction with our College of Health Professions. And that particular degree is for people that are interested in an informatics career path, where they work a lot with the electronic medical records and programming, therapeutic software, and that sort of thing. So lots of opportunities there. They all have their various advantages for doing them concurrently, usually related to time and money. But those are all opportunities that are available here for our students. If you don't know much about pharmacists, this kind of shows what the education of a pharmacist looks like. So the interesting thing about pharmacy compared to other professional graduate degree programs is you do not have to have a bachelor's degree before you start. As long as you finish up 66 hours of prerequisite credits, you can go ahead and track in. So a lot of programs will have students track in after their sophomore year in college and go straight into the graduate program. We have a lot of students that finish a bachelor's degree and come in after a bachelor's degree. We have people that finish a bachelor's degree, go on and practice doing something and come back and do pharmacy. And a couple of years ago, we started an early assurance program where we admit high school students directly into the program. They can go to whatever college they want to complete their 2 years of prerequisites. And as long as they meet certain academic standards, then they track right into the program after that. So lots of different ways to come in compared to a lot of some of the other graduate health professional degrees. Once you're with us for 4 total years. Once you finish the program, you have 2 exams that you have to pass. They are the NAPLEX and the MJPE. The NAPLEX being the pharmacy exam at the national level and the MJPE being a law exam. So you have to successfully pass both of those. And then you can either go into practice from there, or you can go on into postgraduate residency or fellowship training. Residencies and fellowships are not required in the pharmacy profession like they are in medical school. They are optional. And I'd say probably about 50% of our students will go on to do that special additional training. Once they come into the job market, all of our practitioners, anybody who's practicing, has to maintain continuing education credit, which I think is pretty standard across all health professions. And I mentioned earlier that a lot of pharmacists, especially ones that work in the hospital setting or in ambulatory clinics that are affiliated with hospitals, will specialize in certain areas. And those individuals tend to get board certified, which again is an optional thing for pharmacists, but it just shows that you have certain expertises in different specialty areas. For instance, I was a critical care practitioner. I worked in the surgical trauma ICU, and I was board certified as a pharmacotherapy specialist as well as a nutrition support specialist, because I did a lot of nutrition work as well. But there's board certifications in pediatrics, oncology, critical care, and many other areas that you would think of that go with those sort of specialties. So again, I'm going to just flip through some of these. This gives you an idea for a first-year student what a typical academic year is currently looking like for our students. So they tend to carry about 18 hours each semester. The thing that really gets a lot of our first-year students first semester is that load of the number of courses they're taking in one semester. Probably in your undergraduate work, you have never taken 9 courses in one semester. You'll notice several of those are only 1 credit classes, but most of our students, if they struggle with time management that first semester. Most of them are ready for the fast pace, like drinking through the water hose kind of information that you're going to start getting at the graduate education level, but kind of juggling that along with the number of courses that they're taking that first semester can be a challenge sometimes for our students. Just flip through some of these for time's sake. So our students will start doing their experiential learning after in the summer of their first professional year. So during the first professional year, they're working in a community lab setting. So they will be in compounding and community lab their entire first year. And then that first summer, they go out into a community pharmacy and do a 4-week experience that summer. The rest of the summer is open to do whatever you'd like to do. The second summer, we do the same sort of sequence, but this time it's within the hospital setting. So you've been in a year of hospital lab, and then you go and practice what you've learned during that summer. And then the fourth academic year in pharmacy school is all experiential in nature. So the students are out on rotation the entire year. And just so you can get a feel for it, they have to do 5 required rotations within the curriculum. They have to do 2 from the acute general medicine category and 1 from each of the other categories you see listed there, the hospital, community, and ambulatory care. So you can see it's probably similar to what you would be thinking of with medical school too, with the types of acute medicine and ambulatory care rotations that our students are involved in. So they do 5 required rotations, and then they get 4 elective rotations that they can pick from any of the things that you see listed here. And it's nice because our students do get the opportunity to preference their rotation schedules. We have a system that kind of meshes the preceptor's availability along with the students' preferences that comes up with your schedule. So you do have some input into that process. This is what our prerequisites look like. And this is probably really similar to what you're looking at if you're interested in medicine or some other graduate healthcare education. So kind of the typical chemistries, microbiology, physics, all that sort of stuff. So it's a total of 66 credit hours. And this just gives a little bit about our admissions process. Again, I think this is probably going to be really similar to what you'll see with any of the graduate health professions programs. We look at both the cumulative and the key GPA. We have an exam called the PCAT, which is similar to the MCAT for medical school. And this year, a lot of the colleges of pharmacy around the country have made the PCAT an optional component of the application. So for students who might need a little boost in their application because maybe they had a bad freshman year academically or something, we recommend that those students take the PCAT, but otherwise you don't necessarily have to take that entrance exam. We interview all of our candidates, look at your personal statement. We evaluate your writing off of that, letters of reference. We have a diversity section that we encourage everyone to fill out, and then look at the additional activities that you're probably starting to get involved in if you haven't already with where you are. We enroll a class size of 80 students each year in our college. And we pretty much are interviewing throughout the academic year, aside from the summer months. Interestingly, this is the last year pharmacy is going to be doing early decision. This was a national decision. So as of next cycle, there will be no early decision process within our interview process. This is what tuition looks like for folks that are coming to pharmacy school. So the in-state is about $27,000. You can see the non-resident rate, but a big but for those of you who may be from out of state. We do out-of-state tuition waivers. So if we have strong candidates from out of state, which oftentimes we do grant tuition waivers that will get that tuition to that in-state resident rate for most of our out-of-state candidates. So we always tell people not to let that be a deterrent to applying to the program. We also have a Dean Scholarship Program, which is strictly for students that are matriculating into the program. So if you interview and are accepted and it's an academic merit-based scholarship, you would get that offer within your offer letter along with the tuition waiver offer if we're able to give that to you. And we also have a bunch of different scholarship opportunities aside from those two. And this year we gave out about $1 million in financial support to our students. These are just a few things specifically about our College of Pharmacy. The first 2 come from our student satisfaction survey, showing that our students feel like our faculty are very effective teachers and our graduates believe they've received a high quality education while they've been with us. We have to report that employment statistic to our Board of Pharmacy every year at 6 months, and we have a 96% employment rate for our graduates. Our NAPLEX pass rates and our residency match rates are very good. Again, unlike medical school, there are not enough residencies to go around for the number of students who want to do residencies. So an 83% match rate for a program is really good if you look at what the national match rate is. So that's a little bit different for pharmacy than it is for medicine. This slide just shows where our students go when they graduate. And again, a good chunk of them are still going out into the community setting in some way, shape, or form. And then another big chunk of them are going on to do residency and fellowship training. And those are just some pretty pictures of Charleston. If you guys haven't been here before, it's taken by one of our former students. And I think I stayed on time for you. That's all I've got. I'll be happy to answer any questions you guys have if you have any for me.
I have just one about the relationship, or like maybe just the difference between pharmacy and pharmacology, and like how related they are.
As far as a career path, you mean?
Yeah, so because I know that pharmacology has more to do with drug development and the mechanisms of that. And so is there any, and like I saw one of the first year courses and the second year, or maybe the second semester courses had it, like they just had the word pharmacology in them.
Yeah. I mean, honestly, that's just kind of a component of training for pharmacy. I mean, we do have people that are in our drug discovery research side of things that do a lot with drug discovery research. But I mean, pharmacology is just that piece of learning all of those ins and outs of all the drug therapies, how they work within the body, which is part of the curriculum for a pharmacist. You'll get that in medical school too. You'll only get it for about a semester though. That's why I always think it's always crazy. It's like the sore part for pharmacists that we go to school for 4 years to learn all the ins and outs of everything you could possibly know about drug therapy. And there's other people that are prescribers that have 1 semester of pharmacology that are prescribing medications, but we can't. So it's a very interesting dynamic for sure. Well, I am happy, Dalton, to send you a PDF copy of these slides if you want to send them out along with the video link.
Yeah.
To do that if they want to read any more about any of the MUSC information that was in there. But since we were kind of tight on time, I didn't want to spend too much time focusing on that today.
Of course, I appreciate that. I will send out this to everybody that registers for the event. If you can send me the PowerPoint.
Awesome. Very good. Well, if you ladies have any other questions, feel free to reach out. He's got our contact information, so we'd love to talk to you more if you have any interest.
Okay. Thank you so much for your time and for explaining.
Thank you. You guys have a great rest of the day.
You too.
You too.
Appreciate it.